Okay, now we're ready. All right, good morning, everyone. The other day, I was using AI, and I asked ChatGPT if it could create an image for me to demonstrate what it feels like to navigate the U.S. healthcare system. And this is what it came up with. And if you're laughing, thank you, but it's kind of sad. You understand that it can be complicated and confusing, and a lot of times my patients describe it a little differently, which I think is a little dramatic, but I understand. It can feel like a war zone, it can feel like a maze, it can be difficult. And that's kind of unfortunate. When I was young, I thought of the healthcare system as perfect. It was glorified in TV shows where doctors and nurses seemed so intelligent and successful, and it actually inspired me when I was young to join the healthcare system as my profession. I learned about physical therapy when I was 15, which is basically a personal trainer with a healthcare background that can help rehabilitate people if they have injuries or pain or weakness. And at the time I was 15, I started a weightlifting team at my high school. I was really into anatomy and science, and I actually enjoyed motivating people to exercise. And as a little kid, I wanted to be a dinosaur, so I guess you could say it kind of worked out. But really, when I was young, I decided that's what I want to do, and I went to Florida State University. I got my bachelor's degree in exercise physiology. I went to Nova Southeastern to get my degree in physical therapy, where I got my doctorate. And I got licensed at the end of 2019. And then in 2020, the world changed. And suddenly, people didn't want to get close to me. It was difficult to do my job. In fact, I actually lost my job for a few months. And I started to feel like that dinosaur again, except people are running away from me for real this time. But the world came back to normal. I got my job back. The clinic opened up again. And I thought everything's back to normal. But it wasn't. The world changed in ways I just didn't anticipate. I'm sure you're all familiar with inflation. The thing with healthcare is you're paid based on what you can bill insurance companies and what can be reimbursed. And in physical therapy, reimbursement has not only failed to keep up with inflation, but it's decreased over time. And that has really wedged a lot of clinics. It's been difficult for them to be profitable. And as a result, they've had a plateau on salaries for physical therapists. And to remain profitable, they decided we'll just bring more patients in. So more patients are being seen by the same therapist at the same time. And to me, that meant worse care for my patients and a worse experience for me as the provider. So I wasn't happy with that. It made me change the way I think about the profession, and it actually inspired me to create my business. So before we go into that, I need to explain what the traditional model is in physical therapy. So let's say, for example, your shoulder hurts, and you call your doctor, and they recommend you to an orthopedic specialist. So you go and make an appointment, and they check out your shoulder, they do some tests, they say, well, you don't need surgery, but it's probably a rotator cuff strain. Here's a prescription, go to this physical therapy clinic. You make an appointment there, you drive to the clinic, you notice the therapist is working with 2 other people at the same time as you, and because of stricter guidelines, they're on their computer a lot. So a couple of things to highlight here. We talked about the importance of time. You've already lost time just going from problem to solution. It took a lot of time just to get into the clinic. It also takes you time to drive to the clinic and drive home and deal with traffic and waiting rooms. You don't get the best experience because it's a busy clinic. You may not even feel like you have the privacy trying to work with one provider while 2 other people are. And you may not have their best attention if they're worried about documenting. The benefit of this model is they take your insurance, so you don't pay as much. You may have a copay. And for some people, that may be their only option. Like I said, we've had inflation. And so you may be encouraged to only go to a clinic where your insurance is accepted. But with my model, I don't take insurance. So it would look a little bit different. If, let's say, the same situation, your shoulder's hurting. You would call me directly, and I would see you tomorrow or the day after. I drive to my patients, and I treat them in their homes, or sometimes in their office if they work in their own office. So the difference here is it saves you time. You don't have to drive somewhere. You also get seen faster. You get a one-on-one experience. And I'm not required to document as much, so you get a little bit better value of care and a direct line of communication with your provider, which I think is invaluable. My typical clients are busy professionals. They just don't have time in the day to leave their job, drive through traffic to a clinic, have an appointment, drive back to their office. It's not an option. My other patients are people who have difficulty getting out of their house. It might just be too strenuous to leave their home and to go out to another place. So because I go to them, it saves them a lot of time and effort. And some people work from home and they just don't want to leave. They just like the convenience of having someone come to them. I wasn't satisfied with my career and my options. And I decided the only way was to create my own. And it's been a difficult road, but it's been rewarding. And in doing so, not only did I make a better path for myself, but for some people, they've had better options for their own health care. And so that has inspired me to continue on my path. I'd like to challenge you, everyone in this room, to take this beyond physical therapy, beyond healthcare, and just apply it to your own life. If you're not satisfied with an option, don't be afraid to create your own solution. Sometimes you're not in a position where you can create a solution, and sometimes you feel like you only have one bad option. In that situation, I would say don't be afraid to reach out to somebody else. I've noticed some people suffer in silence and let traditional thinking put them in a box where maybe thinking outside the box can come up with a better solution. With this approach, you can better navigate not just healthcare, but problems in your life. And in doing so, you may inspire others to navigate their life better as well.